What is really new has actually already been brought yesterday in a sister society meeting where a colleague of mine from Holland, Professor van Buigen, presented the data from a large multi-center collection of questionnaires submitted to various populations in several countries. And what she showed, and what has really astonished me, it was which skin diseases are originating the most cases of stigmatization. And I believe that if you asked any dermatologist, he would say, probably think first of all of psoriasis and then possibly of vitiligo. And actually, while psoriasis is well represented, vitiligo does not constitute a major cause for stigmatization. And this has actually surprised me. And secondly, in the study, they also showed that there are various covariates, various other causes that modulate the appearance of stigmatization among patients. I'd like to, first of all, to make it clear that this study was not conducted by me, so I am not responsible for it, but it was excellently, very well done. Well, you have a specific questionnaire, a stigmatization questionnaire, so you ask people, you submit the questionnaire and they reply with questions. Psoriasis and atopic dermatitis, and then, much to my astonishment, bullous diseases, which are not very well known to the public. Well, the age varies. You cannot really tell because, in general, one can assume that atopic dermatitis is more relevant in childhood. But we do, I believe, underestimate the number of adults that are affected by atopic dermatitis, that suffer from it. Well, I think that first of all, we should be aware that stigmatization may not always be outspoken. So the patient may not always report those feelings. And so we should be more prepared to verbalize any issue that we feel is somewhere standing in the air like an elephant in the room and that nobody dares to address. So if you feel that there is a relevant psychological suffering in the patient, please ask. There's no harm in asking. And mostly you will find them more than ready to reply and to react and provide you with information. Being aware of stigmatization means also being aware of the damage that stigmatization can cause with compliance. So if the patient feels stigmatized and has to cut his social contacts, he will not be as compliant and as much taking care of his health as he could be or she could be. So my first advice is generally, don't be afraid to ask. Don't be afraid to touch a sensitive issue if you feel that there's something in the air. The second advice is make sure how much psychological symptoms may affect the coping of the patient, may affect the acceptance of the treatment, and may also affect the choice of the treatment, which should be, by all means, be shared between patient and doctor. And maybe a more sophisticated advice, listen to yourself while you're speaking to a patient. Please. I believe that we do not estimate enough, we do not understand enough the importance of the concept of countertransference, which was actually brought in by Freud and does not really resonate enough within the domain of general medicine. Doctors should start listening to themselves, to what goes on within them while they are interviewing a patient, while they are talking to the patient, while they are listening to a patient. And this may give a clue whether the relationship is working or not. If you feel irritated, if you feel unsatisfied at the end of an interview with a patient, then there must be something that is leaving the patient unsatisfied. So my advice is gnosis euton, know yourself before you know the patient. Well, I believe that the European Society for Dermatology and Psychiatry, which has organized this study and in various countries, is doing a very important job. And that is also the task force for psychodermatology of the European Academy is very, very efficient in disseminating the concepts of psychological suffering, stigmatization, and so on. So I think that we are on the right way to improve the quality of dermatological care as far as psychological suffering is concerned.